In Japan right now, a fresh surge of coronavirus cases is putting pressure on the country's healthcare system. There are currently more than 13,000 known cases in Japan and 360 confirmed deaths, with nearly 60 new confirmed cases among crew members on board an Italian cruise ship that's docked for repairs in Japan. No passengers are on that cruise ship. CNN's Will Ripley is joining us from Tokyo right now. Will, so how are Japan's health officials handling this crisis?
This is becoming a very worrying situation for health officials and for the Japanese public, Wolf, because as a lot of other countries are flattening the curve, the exact opposite is happening here in Japan. In fact, just in the last month, the number of cases of coronavirus has increased by more than 10 times. And yet here in Tokyo, a city of 13.5 million, they're testing fewer than 300 people per day. Loudspeakers are blaring across Tokyo, warning people to stay home. Some are listening, many are not. Packing supermarkets, parks and playgrounds, even pachinko gambling parlors. Japanese health experts warn without social distancing, hundreds of thousands could die of coronavirus. Getting tested remains incredibly difficult. Futa Nagao's 4-year-old daughter Kaoru had a 104-degree fever, 40 degrees Celsius for 4 days. My wife and I were very nervous, he says, desperately asking for a test, but they kept saying no. They even hung up on me. Within days, his entire family was sick. They tried to get tested for 2 agonizing weeks. It was scary, he says. Our first daughter also had a fever, then a seizure. We took her to the hospital, but it was too late. Ichiko was just 16 months old when she died of flu-related meningitis 5 years ago. Nagao's wife and children were never tested for coronavirus. Dr. Fumio Harada says the same thing is happening to a lot of his patients. Only 10% of my requests are accepted, he says. 90% of your requests denied. On average this month, Tokyo is testing less than 300 people a day. Japan's health ministry has repeatedly told CNN widespread testing would be a waste of resources. Just this week, some areas did begin offering drive-through and walk-through testing, but it's not widely available. Undertesting is not the only problem. Hospitals are turning away ambulances at a rate 4 times higher than last April. So your patient is laying there for up to 9 hours, getting no treatment whatsoever, and hospitals kept turning him away? I never experienced being turned away by so many hospitals before the coronavirus outbreak, he says. Japan's Medical Association warns the public health system is on the brink of collapse, running low on ICU beds, ventilators, and personal protective equipment. We only get 1 mask per week, says Hiromi. CNN agreed not to use her full name or identify her hospital. How is 1 mask a week possibly enough to keep you safe from the virus? It's scary, she says, showing me the cloth mask she uses. Experts warn cloth masks don't protect nurses from coronavirus. Several Japanese hospitals have already become clusters of infection. I'm worried about how long this will continue, she says. I'm afraid there's no end in sight. With case numbers skyrocketing in Japan, this may be just the beginning. Japan is entering the Golden Week holiday period under a nationwide state of emergency. Now, that will mean that fewer people are going to work and hopefully fewer people packing public transportation and offices in large cities like Tokyo. The question, Wolf, will people stay home? Will they abide by the government's requests that they practice social distancing? There is an observable sense of complacency among some members of the Japanese public, in part because the number of cases when compared to other countries is still relatively low, as is the number of deaths. But keep in mind, there is still a severe lack of widespread testing, and the government's messaging about coronavirus didn't really get serious, Wolf, until after they announced the postponement of the Tokyo 2020 Olympics.
That's very disturbing.